Pain is not a diagnosis, it is a signal. In my practice, I have spent decades treating patients who have been told their chronic pain is just something they have to live with. But when we look at the intersection of leaky gut and chronic pain, we find that this is not a life sentence. It is a biological terrain that has drifted out of balance. Today, I want to discuss how the gut barrier is actually the foundational gatekeeper for the entire pain signaling system. The clinical term for what we call leaky gut is increased intestinal permeability. It is a phenomenon where the tight junctions of the intestinal epithelium, those microscopic gatekeepers that manage nutrient absorption, lose their structural integrity. When these junctions fail, the gut becomes a wide open gate. This allows lipopolysaccharides, or LPS, which are the cell wall components of gram-negative bacteria, to translocate from the gut lumen into systemic circulation. This is the start of the cytokine storm. Once LPS reaches the bloodstream, it binds to toll-like receptor 4 on circulating immune cells. This triggers a massive systemic release of pro-inflammatory cytokines like tumor necrosis factor alpha, interleukin-6, and interleukin-1 beta. This is not just a localized digestive event, it is a systemic immune activation. When these cytokines flood the system, they increase the permeability of the blood-brain barrier. This allows peripheral inflammatory signals to directly infiltrate the central nervous system. Once inside, they activate microglia, which are the resident immune cells of the brain and spinal cord. Once these microglia are activated, they shift into a pro-inflammatory phenotype, releasing their own cocktail of inflammatory mediators. This neuroinflammation is the literal fuel for central sensitization. It creates a state where the nervous system is locked into a hyper-excitable, painful loop. Furthermore, this chronic inflammatory load creates a massive metabolic demand. This is where mitochondrial dysfunction enters the picture. When cells are constantly fighting an inflammatory surge, mitochondrial efficiency plummets. Your mitochondria become bogged down by metabolic stress. They stop producing ATP efficiently and start churning out reactive oxygen species, which leads to further cellular damage and fatigue. For the patient, this feels like an energy crisis that makes pain recovery impossible because the body simply lacks the metabolic currency to heal. So, how do we intervene? This is where we reject the assembly line model of treating pain. We have to identify the signal and fix the terrain. First, we address SIBO, or small intestinal bacterial overgrowth. This is a common, often hidden driver of gut dysbiosis. When bacteria colonize the small intestine, they actively damage the epithelial lining and drive the very permeability we are discussing. We use testing to identify this, and then we treat the dysbiosis aggressively. Second, we implement a structured elimination diet. This is not a weight loss fad, it is an immunological reset. We remove the common food antigens that are keeping the immune system at the gut surface in a state of constant low-grade alarm. By removing these, we stop the constant barrage on the immune system, giving the gut lining a chance to actually repair itself. Third, we use therapeutic foods like specific probiotic yogurt. I am not talking about sugary mass market options. I mean specific, fermented cultures that deliver live beneficial bacteria directly to the microbiome. These cultures produce short-chain fatty acids like butyrate, which are the primary fuel source for the colonocytes that line your gut. Butyrate is essential for strengthening the barrier, promoting the expression of tight junction proteins, and keeping the inflammation localized and controlled. This approach, addressing the dysbiosis, removing the dietary triggers, and restoring the microbiome terrain, is how you effectively lower the systemic inflammatory load. When you lower the LPS and cytokine burden, you turn down the volume on microglial activation. You give the mitochondria a chance to regain efficiency. And when the metabolic demand of inflammation is removed, the nervous system can finally downregulate its sensitivity. The contrarian view here is simple. If you are receiving endless injections for pain without addressing the metabolic inflammation coming from your gut, you are merely silencing the alarm without ever putting out the fire. Most modern pain management fails because it treats the periphery while ignoring the systemic metabolic disaster often happening in the gut. I challenge you to stop looking at your pain as a mechanical failure of a joint or a nerve. Start looking at it as a signal from your body that your biological terrain is overloaded. By focusing on the gut-brain axis and prioritizing metabolic health, we can often reset the nervous system. It is time to treat the root cause.